So hi guys, and welcome back to, would I say, Life with Ife or Ifeoluwa the Medical Muse. We've officially rebranded as Ifeoluwa the Medical Muse, so you know on any social media platform you can find me. Welcome. It's been so long that I've been here. Medical school has been dealing with me, but I'm back to the grind. I'm back into the grind. Welcome back to my returning subscribers. And if you're new here, please do this 50-year medical student that is going through a lot in life if you go by subscribing, liking, sharing, and commenting. I think you are likely to have something to say by the time I'm done with this video. You are likely to have, because the things are written here. It might attack you, it might not attack you. And let's get into the video. Right, so today we're going to be talking about something that I think is very important. Drum rolls, please. 10 things you should never, ever tell or do to a medical student or a medical doctor.
I said what I said.
That's what I'm going to talk about. That's what I'm going to talk about in the video. And I listed them here, so I will not forget any point. Do you understand? Number 1. You see somebody sad or down about, oh my god, my exam is starting next week, or oh my god, results have just come out, something around exam period, and you're like, you could read all these topics now in is it 2 days or 3 days? I used to do it. Until you are in the shoes, you would not understand. Some people have magic that they can do it fine, but majority of people cannot do it. So it's important for you to actually be empathetic towards it. It doesn't have to be a medical student. Any course actually is important for you to actually be empathetic towards them and know that, see, the workload they are dealing with is crazy. The workload they are dealing with is a lot. Or the person sees their results and you're like, you see that the person is sad though, and you are like, okay, who was the highest in the class? What's going on? Because I've actually seen it happen. Someone has asked me that, and I think it's very silly, and people should not do that. Again, period. Judge, signed, bam, signed it. Number 2. Sister, but your exam is in 3 months. Why you breathing out? What's good?
Take a deep breath in 3, 2, 1.
I don't have the words to say for you, but any pit way then dig for me. Period. See, some people start preparing 6 months, and it is very justified because these exams, yes, they're gonna hold your neck. I can remember the anatomy exam I wrote in 300 level, and we started our exams at 9 a.m. and we did pens down at 6 p.m. You like 9 a.m. to 6 p.m. we wrote 37 theory and it was answer all, and we also had 600 MCQs, and there was negative marking. You miss, at least they were nice to us, you miss one is minus half mark. So trust me, you're under a lot of tension. I saw people pull their ties. I was among the people that pulled their shoes off. It was that tenseful. It was that tense. So please, let me read so I can be well prepared. Head job. I will just do like this for somebody next time. Head job. Thanks and God bless. Stamped by the job. Stamped. Number 3. This one. I speak on behalf of all the relationship people. See, if you're not ready to have a stance or perspective of sacrifice, don't date a medical personnel. It doesn't even have to be. Don't date anybody that is in the health space at all. From doctors, nurses, medical scientists, pharmacists, optometrists, physiotherapists, anybody in the health space. Don't even date them. Why? Because they actually have a lot that is on their hands. They are going to do their best to balance it, yes. But the time you will get from them will not be as you actually think it would. But if you're in the health space, you will understand that yes, this is actually dealing with a lot. You should cut them slack, give them space, be a support system for them. That is very, very important. I'm trying to learn brachial plexus so I don't break in the exam. So the exam is not complex for me. Did you guys feel that? I'm trying to learn brachial plexus so I don't break in the exam, or the exam is complex for me. Bars. Don't mind me. Serious. Please give them space, give them time, discuss with them, have a routine that benefits you both. Have a time that, okay, 2 of us can speak, and please try to be understanding of them. Number 4. Hey, your course is not hard now. Now you they overdo. Nobody just read and pass.
And trouble is giving to those who want trouble. But the joy of the Lord gives me big strength to jump over it. I beg.
Hope it's just read and part. Do you do negative marking?
Answer me!
Does your course do negative marking?
Answer me!
There's one thing in which, okay, they give 50 questions. You fail 25, you pass 25. So you're getting what, 25 over 50, Abby? Here, in medical school, when you're studying medicine and surgery, if they give you 50 questions, you miss 25. That's 25 over 50. That's not your final score. Now, it depends on how they want to do it. They can decide that for every question you miss is -1. So if the system is -1, that means you have 0 over 50. Do you understand? Because you missed 25. They will minus 25 for the 25 questions that you missed, so you have 0 over 50. Yes. So when you say medical student, say, God, please give me 50. God, please give me 50. Join them on their knees and pray with them. Join them and pray with them. They know, they understand what they are going through. You know, I say medical student that is having credits, that is having distinction. Pass last one. Oh my goodness. We give praise to God. Hallelujah. You don't understand. You don't understand. But here's the thing, understand that there are peculiarities to several courses. These health courses, they deal with life. So there are several things to, let's say, bring or ensure that there's a standard here. So you have to be what understanding. Now, number 5. How? This one, I'm presently in that predicament. And they pay me because somebody asked me this question last Sunday in church. Ife, you're done with school, Abby? No, I'm not done. When will you be done? Oh yeah,
Shut up!
do like this. I'm presently in 500 level, and I finished 400 level months back. This is August, yeah. By this time next year, when you ask me which level am I in, I'm still in 500 level, and I've spent like 4 months already. So like it's like 1 year 6 months or 1 year 5 months in 500 level. Let's not forget that 400 level in normal medical schools is 18 months. So you see me this year, ask me, I'll tell you I'm in 400 level. You see me next day in the same time, I'll tell you I'm in 400 level. It's not my fault. It's not our fault. You understand? That's the calendar. Samples, you heard that medicine is 6 years. Samples medicine is not 6 years old. Sample is going to like 7, 8. There'll be extensions. It's possible that there will be this thing strike. It is very possible. It is very, very, very possible. So those kind of questions, see, they themselves are thinking of it. Do you understand? They're thinking of this, why this school long, why this time long like this time. Don't help them and add to it. Do you understand? Study their demeanor when you ask them, unless you are very, very, very close to them. I feel like they'll be comfortable in actually answering these questions. Do you understand? Yes. So number 6. Sister, I have a headache. My head is paining me. And yes, my cousin told me that a leg, a cousin's brother, sisters, fathers, uncle, cousin's leg is paining them. Please, what do you think it is? What can they use? They have this sales certificates that have not reached my hand. Do you want them to? They can't even collect what they've not given you yet. Do you understand? They can't collect what they've not given you yet. Do you understand? We'll not say okay, from what they taught us in class, go and use this one. Kemal react. Sorry, English. You will now probably go and react because there's some questions you have to ask before you know drugs can be prescribed to you. Yeah, pharmacists and doctors when they're doing consultations, they'll ask you, do you react to this? Are you allergic to anything? If it's just speedy, please don't let me cover myself. Don't let me cover you. Don't cover that medical student. Don't cover Antinos. Please, for God's sake. Do you understand? It's best you go to the hospital so that you can get the appropriate treatment, because they'll ask you for some information that is important. You know, they can talk about from their well of knowledge, the medical students, but it's best for you to go to the hospital. Please go to the hospital. Thank you. Number 7, you see a stereotypical medical student, you know, glasses, bag, everything, books, serious. Medical student. Then you now see someone that parties, someone that has a business, someone that does content creation, someone that goes out a lot. And then person tells you medical student, you're like, medical student, and all that comes to your mind is, this one won't be doctor, or this one won't be nurse, or this one won't be med lab scientist. You're already attributing this quack status to them, you're already looking down on their abilities because they're actually choosing to live a life outside of medicine. You know, medicine is like a jealous lover. It wants all your time. So you have to be intentional about you in medical school, you in any health course at all. You have to be very intentional about how you manage your time, how you manage your passions, because medicine can suck the life out of you. You gotta suck it out. Do you understand? So we're actually very particular about. Some people are okay with just being book, and that's fine. That's what they love to do. But some people like to diversify. Like me myself, you can see a mannequin. I have a clothing store, the 1613 clothing. Please do check me on Instagram and on TikTok for amazing pieces that you can wear for the ladies, for the classy and formal ladies. Yes, so I'm into that. I'm into content creation, I'm into politics, you know, I do research, I'm into other things also. But some people can see me, I'm like, this one, do you understand? So let's change the notion that medical students have to be one way. They're students like you, they also want to have the experience. They should not just pass through school, and the time the school should also pass through them. So let's deal with that stereotype, okay? Do your year like this, okay? I'll trick man say. Now, number 8, there are the medical students that they like reading a lot, and you can go like, every time I'm calling you book, you're always reading. Please, let them read in peace. There's some people that you see reading, there's some that you don't see reading. People that go clubbing, they will come back around maybe like 1. They can stay awake to like 6 to read. And so don't judge people based on, okay, they're not reading or they are reading. Everybody in medical school is actually doing what they can to become good doctors. Yes, they're actually doing what they can to become absolutely good doctors. Whether you see them reading or not, don't look down on them. Number 9. This particular one, I feel like it's not controversial in the health space, but it's not something that should be said because it is degrading to the profession. I hear that doctors are guessers, medical doctors are guessers. It is a fallacy because medical doctors would actually send for tests, they would send for certain blood works and all based on what they actually think is wrong with the patients. They would send for scans and all. So they have to have a background knowledge on these things for them to actually say, okay, I think this should be. We call it differential diagnosis because we know that you can't entirely know everything. Yes. And what we're going to is that for everything that we think this could be, we are going to make proper investigation on it to pick out which one is which one. There's something we call ruling out when you're doing postings. You think this person has something, and you start ruling things out. Okay, this can be it, this can be it. So they are putting a lot of mental, physical effort into this for doctors to just be called guessers. It is not right, and let's not do that. Yes, thank you. Number 9, doctors lack empathy. Now I know that people come to the hospital and they are, something happens to their probably a family member there or something, and they're just like, oh, doctors, or it's not even just doctors, health personnel in general they lack empathy. I mean, of course, there'll be some that do lack empathy, but then see, some of the people, they are actually busy. One doctor is attending to 50 patients, one doctor is attending to 10 patients at once. He's being pulled left and right. He has reports to write, he has case notes to follow up on and all that. So he's therefore do his job and go. Now, I'm not saying it's an excuse for you to actually be emotionally unavailable for your patients, but they cannot be as open and as jovial as they, because they are busy. Some of them are still on call. Call is like, okay, from yesterday like 9 a.m. to this morning 9 a.m. depending on the time that the hospital is using or the system they're using for them. They're on their feet for 24 hours, sleep deprived and stressed out. And then the thing about call is that after that, your 9 a.m. you still have to continue the day's work. Call or no call, you do your 9 to 5. So imagine doing 9 to 9 and still having to continue that same day 9 to 5. They are stressed, they are tired, but they are still trying to keep the mental strength they have to ensure that they do what they have to do for the patients. I hope that this system can eventually change. Our leaders in the MDC, that's Medical and Dental Council of Nigeria, I hope it can actually change. I don't know if that's how it is for other health professions, but I hope it's something that we can actually collectively change for the good of the patient, because at the end of the day, the entire health team is made up of the doctors, the nurses, med lab scientists, all of us in the health field. Our main goal is the patient, for the patient to be alright. That is our main goal. We work together as a team. We are one. We work together as a team for it. So if something benefits, if something is going to make one person's work rate better, why can't we do it? If it's going to make people's work rate better, why can't we do it? If it's going to make everybody's work rate better, why can't we do it? It helps the team at the end of the day. Now, this is the last one. I feel like this is one that is not just for medical students, but even medical doctors and even people in the health space in generally. You picked medicine now, and you say you love medicine, so why are you complaining? Why are you complaining about the stress, the long hours, the classes from 9 to 6? You're staying in the dissection lab, you're inhaling formalin, you're complaining. Oh, but they're paying you now, aren't they paying you? So why are you complaining? we say that doctors and health professionals, they lack empathy. I think people that actually say that also lack empathy, because just because you are paid for something doesn't take the humanity or the emotions out of you. You're still human, you feel things, you experience things. So just because they are being paid for it doesn't mean that they still don't feel. Doctors get fatigued, doctors get sick, doctors get tired, doctors need break also. And I'm saying doctors, rather, let me say the entire health team, the entire medical team in general, they need breaks. They also have things that they are dealing with. Yes, on the job they are doing their best on the job. So it doesn't mean that if they're now in this space where they can actually be vulnerable and talk to you that, okay, please, I feel tired about this, I need to rest, I need to do this, I need to do that. Don't now take it as no be normal job. We're dealing with lives here. You see nurses giving injections, you see the med lab scientists running tests on blood samples, stool samples. Those things take rapt attention. Pharmacists are giving you the drugs to ensure that they're giving you the right dose, they're giving you the right brand, they're giving you what that you will not be allergic to. It takes a mental focus. It takes proper application of everything you've learned in school to actually do this. So yes, they are mentally working back to back every time they're in the office. So of course, it's normal that they could feel mentally drained. That's aside from the physical fatigue that they will actually go through. So be a safe space for these people. You know, I can't talk for other professions aside from the health and the medical profession. I cannot talk about it, but when I can talk about, I will talk about it. So here am I am hoping that, you know, the system gets better for the medical team, so that the medical team can actually serve the patients and the community better. At the same time, patient also has a role. Patients and patient relatives also have a role to play in the proper and cordial relationship between the medical team and the, you know, and the community, the patient and patient family. So here's to every medical personnel out there, whether you're studying medicine, nursing, pharmacy, physiotherapy, pharmacology, med lab science, psychology. I'm sorry if I can't really remember some of the courses now, but you are amazing, and I hope that you get the emotional comfort and emotional space that you actually need to carry out all your duties well. We are one team, and let's support each other and to speak out for each other. So till next time, when I bring you something very, 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 very nice. I think my next video is going to be private versus public medical schools, opinions, myths and facts. I'll be sending out a link to hear your perspective on these systems. So let's see how spicy that video is going to be. Thank you so much for staying tuned to this time. Please don't forget to drop a like, comment, and ensure you subscribe, and ensure you share, and ensure you share. Thank you so much, and it is a wrap for today on Ifeoluwa, the medical news. Until the next time, bye.